Now, this video you're seeing here is about a child that was allegedly infected with HIV/AIDS in a private hospital in Edo State. And according to the complaint of the parents, they said that they brought the child in because of malaria and he ended up being infected with HIV. Just listen.
The parents of a 19-month-old baby boy, Praise and Mimi Mumbo, says their child, Jeremiah, contracted HIV following 2 blood transfusions at Safe Bliss Medical Center, a private hospital in Benin City. According to the child's father, Praise Mumbo, he said baby Jeremiah was first admitted to the hospital on February 6, 2025, with high fever and a critically low blood level. With the packed cell volume PCV reading at just 11%, the hospital advised an urgent transfusion and blood worth 40,000 naira was purchased and administered. The family returned to the same hospital on May 3, 2025 for a second admission. Once again, the hospital recommended a transfusion. Mr. Mumbo says that although he and his wife offered to donate blood, the hospital allegedly declined, citing unavailability of lab personnel to screen it. They were instead asked to purchase another unit of blood for 35,000 naira. He said his family was devastated when doctors at the government hospital later told him his baby had HIV as he appealed for justice for his son.
When my baby temperature was very high, which is this year, February 6, so we took him to Safe Bliss Medical Center along Sloko Road. So when we get there, they do all the necessary tests for his body that he have a PCV is very low and he have fever and temperature is very high. So they do both HIV tests that day. And when they do the test, HIV test, which is ROVS, show negative. It show negative. And after they do the test finish, that they need to give me blood. And I suggest that I should donate my own blood. They say that there are lab scientists not around that they can take blood from me and it will take a long process. That the baby temperature is very high.
Just go out
to a condition that they need to buy blood the faster way. So I don't have choice because the baby condition, I was very scared at that moment. So I now make a deposit and they bring the blood within some minutes. If I'm not mistaken, it's not up to 30 minutes. So they bring the blood. After they bring the blood, they transfuse the blood on him. After they admit us and they transfuse the blood on him, they give him the blood twice.
Following the diagnosis at the government hospital, the couple filed a formal complaint with the Edo State Ministry of Health and the Office of the Attorney General, alleging negligence and unsafe medical practices.
I received a petition from the parents of that young child. We are going to make sure that we follow through that matter to see that justice is done and put squarely the blame where it should belong.
In response to the allegations, the Edo State Commissioner for Health, Dr. Cyril Oshomole, confirmed that Safe Bliss Medical Center has been sealed. He said investigations revealed that the hospital was operating without registration. Dr. Cyril Oshomole said preliminary findings show that the blood donors tested HIV negative as of July 28, 2025. He added that the parents have also been screened.
We still up the hospital. The donors, we've taken their blood sample. They were both HIV negative. This is horrific. I wouldn't wish that for my enemy at all.
As at 28th of July 2025, attempts to get a direct comment from Safe Bliss Medical Center were unsuccessful. The hospital directed all inquiries to their legal counsel, who stated that a public response would be issued at a later date.
Bringing your child to a hospital just because that child has what? Malaria. And then at the end, after everything, after all the tests, after paying everything that the hospital asked you to pay, they are bringing a result telling you that the child has what? HIV. As a parent, how are you going to take it? Now, I want you to pay attention. First and foremost, if you take a child to a hospital and the doctor is asking for blood transfusion, now, it is your duty as a parent to make sure that the doctor, they run tests on that blood that they are going to give to your child or to your siblings. Make sure that the blood is safe. That is one. And it is your right as a patient stroke parents to also demand to see the result of that blood. It is your absolute right as a patient. The number of HIV cases in Nigeria is on the increase, especially in places like Akwa Ibom State, Edo State, Enugu State, and other places in Nigeria. And so be very, very careful on how you give blood to patients. As a doctor, always run the test. No matter how urgent it is, always check the blood and make sure that that blood is safe. How many people has had to go through this process? They will go to a hospital and the doctor will say that they need a blood transfusion, and then after everything they will notice that the blood that they gave them had one issue or the other. How many people? And to say that these are trained doctors, these are trained lab scientists that are making these mistakes. And at the end, we blame everything on government, saying that it is because of government. And tell me, is government the doctor that made that mistake? Just imagine. And also, a few months ago, there was a complaint by the Nigeria Medical Association saying that they are being underpaid. Now, I honestly understand that in terms of healthcare and everything, the government honestly needs to do better. They really need to start paying doctors well in Nigeria, because if I tell you what doctors are facing in Nigeria, a lot of you are not going to believe it. But outside of that, doctors also need to learn to dot their I's and to cross their T's every time. All this mistake that they continue to make in hospitals and everything, it needs to be stopped. There has to be a strategy that is put in place to curb all this nonsense. How many doctors has tried to maybe deliver a baby, and due to one error or the other, the baby will die? Not to talk of other silly mistake they are making that a lot of people are coming out to complain of. And some of them, they will like to cover it up. Why? Because they know that if it gets out, their license will be withdrawn. So in case of next time, this other one has been made already. Just imagine, and this one now is a child, a little child that is less than 3 years from what I got. Less than 3 years, already having what? HIV, due to the negligence of doctors and those working under him. Imagine the stigma that child is going to grow up with. Just imagine. So please and please, if you're a doctor out there, before you do any form of transfusion for a patient, always make sure that you run your test. Always make sure that the blood is clean. Always make sure that everything is in proper state. Don't forget to like this video and subscribe to my channel if you have not done so. I'll see you guys in my next video.